Hello and welcome to another edition of Health Matters. My name is Dr. Michael Chillemi, and today what we're going to talk about is something that affects millions and millions of people every single day. So we're going to talk about herniated discs. We're going to talk about the symptoms, the causes, the diagnosis, and the treatment options. So in this episode, herniated discs will be discussed at detail. We will cover how it affects people's lives. We're going to cover all the different types of disc injuries, including disc bulges, disc protrusions, disc sequestrins, disc disease. We're going to talk about a lot of different things about disc conditions and what happened, what do we do, and how do we do it? So first things first, we got to say, what is a disc? What does a herniated disc mean? What is the definition? So herniated disc is also known as a slip disc or a ruptured disc. This occurs when the inner cells of the disc itself, which is gel-like material, we call that the nucleus pulposus of the spinal discs, leaks out through a tear in the outer layer. The outer layer is called the annulosis fibrosis. Let's take a quick look real quick. So this outer layer here is the annulus fibrosis, and inside it, which this one you can't see, but inside the middle of it, there is a circle. That circle is gel-like material, and that's the nucleus pulposus. Let's explain the anatomy of an intervertebral disc. So the intervertebral disc acts as a cushion between both vertebrae, just as you see here. It acts as a cushion in between the vertebrae. So the outer layer is very tough, and that's the annulus fibrosis again. And the inner layer is very soft, jelly-like material, and that's called the nucleus pulposus. So what are all these fancy words? Let's break down the anatomy of the disc structure. So the annulus fibrosis is the outer ring of the intervertebral disc. It is composed of several layers of fibrocartilage. The fibrocartilage is what makes it tough, durable, and providing the disc with its strength and stability. Now, the inner layer, which is the nucleus pulposus, being gel-like material, composed mostly of water, but also has collagen fibers as well. It provides a disc with some cushioning properties as well. So where are the discs located? The discs are located in between the intervertebral bodies. So they're in between the vertebrae. So if we break it down even further, the cervical, thoracic, and lumbar are the different areas that have discs. The sacrum and the coccyx do not. And I'll break that down a little further in a couple seconds. So what is the function of the intervertebral disc? The function is first to be a shock absorber, right? It's got to be the shock absorber in between the discs. It's meant to withstand forces from loads being pushed down on it, such as walking, running, and lifting. Second, it's meant to be flexible, providing movement from left to right. And rotation, obviously. The discs contribute to the range of motion, which allows for bending and twisting and all the motions that we have of our spine. Third, it's meant to provide spine stability. The structure of the intervertebral discs help maintain the alignment and the stability of the vertebral column. The intervertebral discs do not have their own blood supply. Their nutrients is done through a process called diffusion from the end plate to the vertebral body. So the end plates of the vertebral bodies, through a process of diffusion, give the discs nutrients. So nutrient diffusion is the movement of nutrients from an area of high concentration of blood vessels to an area of low concentration of blood vessels. So that's what happens in the disc, right? So the end plates have all the blood vessels. The body in its infinite wisdom, body is smart. The body is smart. It takes the blood from the end plates and it supplies the disc material with the nutrients it needs. Now, what are the key nutrients inside a disc? The key nutrients inside a disc are proteoglycans, which are large molecules that attract and retain water, providing the disc with its water-like fluid. It has collagen, which provides tensile strength to the annulus fibers. It has glycoaminoglycans, which are called GAGs. Those are components of proteoglycans that can contribute to the disc ability to resist compression. So when you have a compression injury, or just compression in general. Water, which is essential for maintaining the structure and integrity of the nucleus pulposus. What is the main purpose of the disc? The main purpose, number one, main purpose, load distribution. The discs help distribute loads evenly across the spine, preventing local stress on an individual vertebrae and reducing the risk of fracture. So how does the intervertebral disc protect the spine? So it protects it by forming an area of cushion the vertebral bodies. So when you have that area of cushion around in between the vertebral bodies, it prevents the spinal cord and spinal nerves, which run through the canal and through the vertebrae, to compress. Right? So imagine, so if you're looking at this disc, when you have compression, the nerves are here, your spinal cord's here, your vertebral body's here, here, and here. Your disc is in between. So if, as you can see in through here, right? This area here, this is your spinal nerves, this is your spinal cord. And it is important to know that the disc in between, the height of the disc, is what's important to keep the pressure off this area. So when we're talking about that, it is important to know that things change over time, right? So one of the questions patients ask me is, why do I have pain? I didn't do anything. So sometimes over time, your body gets dehydrated. And as you get dehydrated, this disc in between shrinks, right? So the smaller this is, the closer these bones get together. The closer the bones get together, the more they irritate the nerves. So imagine you're 20 and 30, you have no problems. As you start to get to 40, 50, and 60, and 60 into 70, your discs themselves, they dehydrate, right? They lose their water. The amount of water the body can put into the discs gets less and less. That's naturally how the body ages. That's a normal procedure. Actually, that's why your mother, grandmother, aunt will all shrink as they get older, right? We all shrink, men, women, everybody, right? So the reason you shrink is these discs that are filled with fluid shrink a little bit. And as they shrink, we shrink down. That's why you can have a disc problem without doing anything, right? Does that make sense? If we're not doing anything, but the body itself is decreasing your disc space in between, then what happens is you naturally shrink down. Now, if you have an injury to an area and you have reduced your disc space from an injury, and now you dehydrate that disc, what happens? You put pressure on those nerves significantly more than if you didn't. Okay, I digressed. So in talking about discs, there are other aspects that typically play a role. So age is definitely a big part of it. Over time, the intervertebral discs undergoes degenerative changes. So the reduced water in the nucleus pulposus, which is the middle, and the weakening of the annular fibers, because as you decrease the cushion, you weaken those fibers, that can lead to disc degeneration. And when you have the disc degeneration, that can cause conditions such as disc bulges, disc herniations, and stenosis. So a question people ask me often are, well, how many discs do we have in the spine? So the answer is the human spine consists of 23 intervertebral discs, which are situated between the vertebrae. These discs can be categorized based on their location. In the cervical spine, we have 7 vertebral bodies with 6 intervertebral discs. These discs are located in the neck region. They are identified from C2 to T1. So basically C2 to 3, C3 to 4, C4 to 5, and so on. In the thoracic spine, there are 12 vertebral bodies and 12 intervertebral discs. That's typically the upper back and the mid back. In the lumbar spine, there are 5 vertebral bodies and 5 intervertebral discs. They are located between L1 and S1. So let's get to it. What are the common disc conditions out there for that can have problems? So first, degenerative disc disease, which we just talked a little bit about, disc herniations. There are stages of disc herniation. So the stages of disc herniations in progression are disc bulging, disc protrusion, disc extrusion, and disc sequestration. So let's break it down into detail. First, let's talk about disc degeneration disease. So degenerative disc disease. So that typically happens due to aging. So when we age, like we talked about, those discs dehydrate, body changes, your body starts to break down, right? So then you start to degenerate. When you become degenerative, you start to lose your disc height. And that's called degenerative disc disease, the DDD. It typically affects the intervertebral discs of the spine, and it affects that cushion material, right? So it shrinks it. Despite its name, it's not actually a disease, but rather a condition resulting from wear and tear naturally over time. This condition can lead to pain, instability, and other symptoms due to deterioration and structural integrity. So what causes the progression of DDD? Aging is the primary cause of DDD. As we age, these discs naturally lose hydration and they become less flexible and prone to damage. Next is disc dehydration and thinning. Over time, the discs dehydrate and their ability to absorb the shocks decrease. This causes the space between the vertebral bodies to shrink, leading to increased stress on the spine. Tears and cracks. The outer layer of the disc, which is the annulus fibrosus, can develop tiny cracks and tears due to daily stresses and minor injury. That can lead to pain, and in some cases, the inner core can leak out. And that's the next set of symptoms that we're going to talk about in a minute. Pain. Usually you have chronic pain when you have this type of condition. The pain can be aggravated by bending or sometimes you can have numbness and tingling, some nerve type pain. You could have radicular pain, pain that starts in your neck and goes down your arm into your fingers or from your lower back into your toes. You could have muscle weakness. So if you're affecting the nerve, then you can affect the muscles. Next, let's look at disc bulges. So this is typically the first set in disc herniation. So disc bulge is not really a herniation, right? So it's kind of right before herniation. So what a disc bulge is it's when the outer layer of the disc, which we all know is the annulus fibrosus now, weakens, and it allows the inner gel cell-like material, which is called the nucleus pulposus, to bulge outward, often into the spinal canal. The annulus, so the outer layer remains intact, but the disc itself protrudes outward. So it means it sticks out a little bit. But the outer layer is still there. The nucleus pulposus, so the inside of it, the jelly on the inside of the donut, right? If you want to think of it like that, the jelly inside the donut has not escaped. Typically, a disc bulge involves more than 25% of the disc's circumference, right? So when we're looking at it, and I will try to do it a little bit in here, the disc will slightly bulge out, right? Like that right there. So from there to there, oh, that's too much. There to there is a disc bulge, right? So it's bulging out, but it has not broken through the annulus, right? So basically, when you squeeze a jelly donut, it's just starting to you have made a dent on the outside, but nothing has come out, right? So that's what that is. The bulging of the disc can lead to flattening and ballooning into the space occupied by the spinal cord and the spinal nerves, which may result in some compression of the structures. This condition is less severe than a disc protrusion, which is the next one we're going to talk about, is the first herniation type condition, right? So a disc bulge can present in various severities and can lead to symptomatics, from symptomatic to asymptomatic, meaning you can have symptoms or not. So when a patient presents with symptoms that are specific to a disc bulge, they are often asymptomatic, right? They can have a very little bit of nerve pain, but most of the times that a disc bulge has localized pain, usually affects one side more than the other. It's either in the lower back more or the neck mostly. You may or may not have any radiating type pain. If you have it, you could have it in your arms or legs. A little bit less likely with a bulge. Sometimes you can. You might have, if you have some of those symptoms could be more like tingling or numbness, right? You can feel them in your hands or feet or in your legs. You can have muscle weakness. If it's affecting the nerve, then you're gonna affect your muscles as well. You can have reduced mobility, right? So as you irritate an area, your body will naturally stiffen it up. Your body's gonna protect you. Your body in its infinite wisdom will protect you at all costs. So by protecting you at all costs means that the body will turn your, you ever see somebody that the whole body's tilted to one side, right? They're bent over. That's how they're walking. So I have patients that walk into my office completely bent over to one side. They're bent over to one side is because you have an area that's putting pressure on nerves. And now your body has adjusted you to a position to get the pressure off the nerve. And it won't allow you to go back to straight, because if it does, then you're going to be on that nerve in pain. That's not really for a bulge per se. That's more of the next couple coming. But that's typically what it does. Your body won't allow you to do that. It says, no, I'm not going to let you hurt me. How crazy is that? Your body says, no, you cannot hurt me. It's protecting you. It's sometimes slow now into letting it go. So as you're treating, and I'm kind of digressing a little bit, as you're treating, it doesn't necessarily stop. It sometimes takes time to do that. It does take time to do that. So back to disc bulges. So some of the symptoms can be worse at night and activities such as sitting and standing or lifting can cause more pain. Typically, the presentation of a disc bulge, what we would typically see is low back pain in the lower back or the neck, may or may not have radiating pain or sciatic type pain. You may or may not have numbness or tingling. You may or may not have weakness. You usually have some decrease in motion, right? Your ability to move is very, very common. So stiffness is usually part of it. Okay, now let's talk about disc herniations. With disc herniations is when the nucleus pulposus, so the center, the jelly of the donut, breaks through the annulus fibrosus fibers, potentially compressing nerves, right? So it bulged out, and now it's bulged out, right? It's putting pressure into the nerves. So that's the key with that is, let me see if I can, okay. So when you bulge out, there it is right there. You're compressing that nerve, right? So you see it bulging out and you see the pressure come out. It goes from that to right on that nerve. That's what the herniations are, right? It came through. The jelly came out of the donut, right? You squeeze that jelly donut and boom, up, jelly's out. That is a disc herniation. Okay, so there are three types of disc herniations: disc protrusion, disc extrusion, and disc sequestration. So when we talk about disc protrusions, we're talking about when, just like we just showed you on that model, the inner material has tore through the annulus fibers, the outer fibers, and now you're putting compression on one of your nerves where the material has come out. So there are different levels of protrusions, right? So as it starts to come out and go through those tough outer rings of the disc, it bulges them out and it puts pressure. So the outer layer of the annulus fibers are still intact, but they are bulging beyond the normal parts of it, right? So in a protrusion, the jelly has not come all the way out yet, right? So the bulge is all the way there. So when we're talking about disc protrusion, the inside material, which is the nucleus pulposus, bulges out, but it has not come all the way out, right? So it bulges, right? So it's bulging out, right? So that's just bulging right now. It has not, you can see the bulge come out and you see it put some compression on the areas and the nerves. When we talk about the next one, we're going to talk about what happens after the bulge. So what's the impact of a disc protrusion? Disc protrusions can cause nerve compression, which can lead to significant pain, tingling, and weakness in the limbs. What are the main causes for a disc protrusion? Typically, disc protrusions happen when stress or degenerative changes cause the annulus fibers to weaken and therefore bulge out, causing the area around them to get compromised, and then you could have tears of those fibers and then compression of those nerves. What are the typical characteristics of a disc protrusion? So first, let's look at what a protrusion shape is. Unlike a typical herniation, there are different types, right? In a herniation, there are different types. You could have a broad-based bulging type where the area is wide and it extends, or you could have a little bit more narrow, right? So you want to look at how big the area is and how much of it has bulged out. What are the typical symptoms that come about with a disc protrusion? So with a disc protrusion, the patient may be asymptomatic, or they might have pain because of the compressed nerves. They might have leg pain, arm pain, and severe decreases in motion. So typically it goes disc bulge and then it goes protrusion, right? So the bulge is just slightly bulging out, so it's just slightly coming out, very little bit. The protrusion now you see it bubble out a little bit. Now you see the bubble coming out a little bit. So typically that can cause a decrease in ranges of motion, depending on the severity of the protrusion. In many cases, a disc protrusion may not be noticeable at first, but as the disc gets more irritated and the more it compresses the nerves, the more it can be debilitating and cause severe symptoms. So what are typical symptoms of a disc protrusion? Typically, a disc protrusion has localized pain. Pain might be directly at the site in the lower back or neck. Typically, you have radiating pain. You might have pain that goes into your buttocks, down your legs, into your feet, into your toes, or into your shoulders, into your arms, and into your fingers. So your neck controls your arms and fingers. Your lower back controls your legs and feet. And when you compress these nerves, this is what some of the problems are, right? When you have those areas. You also have muscle weaknesses, right? So muscle weaknesses are typically occurred during a disc protrusion. When you compress that nerve, you're affecting those muscles, right? So I want you to think of compressing a nerve as if you had a garden hose, right? You take that hose and you squeeze down on it, right? So as I'm squeezing down on it, you're compressing that nerve. As you compress that nerve, if that's a garden hose, basically think about yourself stepping on it. When you step on that garden hose, the amount of fluid in that hose comes out is sporadic. So depending on how much you compress your garden hose is how much you're going to affect the nerve flow, right? Nerve flow. So that's what you got to think of. How much am I affecting this nerve flow in my body? When you compress those nerves because of the protrusion, you're affecting nerve flow. So the bigger the protrusion, the more you squeeze down, the more you step down on that garden hose, the less fluid comes out. The same thing in nerves, right? The more you compress your nerves, the less signal responses your body gets from your nerve system. And then you have more pain and problems. You also typically have significant reduction in mobility. You have significant reduction in motion. You also typically have in your lower back what's called sciatica. So let's give you the quick definition of sciatica. Sciatica is a term used to describe a set of symptoms rather than one specific medical condition. It refers to pain that originates along the path of the sciatic nerve. The sciatic nerve runs through the lower back, hips, and buttocks down the leg. So if you have a compression of anywhere on that aspect, you can affect that nerve. This is specific symptom can happen with a disc protrusion when the pain runs down the leg and into the foot. Typically, pain is mild to moderate with a disc protrusion and typically localized to the back or neck. Radiating pain is definitely possible in the arms or fingers with the tingling and numbness. And muscle weakness is definitely a good possibility with this. The longer it stands, the more weakness you typically have, right? So the more you squeeze that hose, the longer that hose gets squeezed, the more you're going to have muscle weakness. Movement typically irritates it. It puts pain on those nerves, especially if you're trying to move where your body doesn't want you to move. It's going to definitely cause you more pain. Okay. Now let's look at one of the big two, right? So disc extrusion and disc sequestration are the next two. We're going to talk about disc extrusion now. These are I say the big two because as you get down into these levels, you have significant changes and significant problematic. It's problems. It's a problem. that you need to take care of. So what a disc extrusion is when the inner core, the nucleus pulposus, part of that material breaks the annular fibers. It comes out, right? It tears them, but now it's actually coming out. So it actually comes out of the disc and now it's coming down where it's affecting it broke through those annular fibers and it is more severe. The bulge has come way through the annulus fibers and now it's putting compression on nerves and maybe spinal cord, right? Usually these patients are very symptomatic with intense and significant pain and significant nerve involvement. So what are their typical symptoms? Let's go through this real quick. Typically, the symptoms can vary depending on whether the material is putting pressure on the nerve or not. Okay, so typically they are severe local radiating pain due to the nerve compression, right? As soon as you compress that nerve, you're going to have those symptoms. The neurological symptoms usually causes an inflammatory response, which makes the symptoms a little bit worse, right? You swell up a little bit, causing more pain and irritation. Pain may affect at the site itself or the extremity, right? So typically you'll have low back pain first and then just leg pain. Okay, if that happens, that's a significant problem, right? So you have significant back pain, you have significant leg pain, your back pain goes away. Now you have still consistent, significant leg pain. You need to get this, you need to get in to see somebody ASAP if that happens. That is a significant sign that it has gotten worse. Now you have done more damage to that area. So that is a big red bell. The red bell is the sound is siren, the sound of the siren is going, the bell is clanking. You need to go see somebody ASAP, right? You're also going to have numbness and tingling, which are typically pins and needles. And you can usually have significant weakness in your extremities. The referred pain, meaning the pain that you feel in other areas, such as your legs, are common. You can have burning sensation, sharp electric-like sensation. Can it be asymptomatic? Anything's possible. It can be. In some cases, it can be. And sometimes they're only discovered during exams of other conditions. Sometimes, you know, he says, Doc, how could it be asymptomatic if it bulged through and it's in the air? If your space is big enough, if your space in between, your nerve is big enough, and let's say your nerve finds a spot up on top and your disc is bulging down, that's how it could be asymptomatic, right? You kind of leave well enough alone. It didn't bother you for a while. Maybe you had it and it didn't cause that pain or pressure yet, right? Maybe you're young. A lot of times we see this with kids in their 20s. They got into an accident when they were a teenager. And now in their 30s and 40s, now they have significant problems. They start to dehydrate, and then you find it. Oh, you have these problems, right? I didn't do anything. Nothing really happened. You had this accident 20 years ago. It caused a significant injury, but because your discs are big and fat, right? They're fat and full of fluid. You have space. As that changes, your body changes, and that compresses that nerve, and that's why you'll have pain and problems, and could be some serious problems if you have a disc extrusion. This is a typical medical consultation that you need to go see somebody ASAP. All right, so let's wrap disc extrusion up really quickly. What's a typical presentation of somebody that has this? Significant and severe either back or neck pain, depending on where it is. Typically, radiating pain into the legs or arms, depending on where it is. Tingling and numbness to the affected area. Possible significant muscle weakness, noticeable weakness from one side to the other, noticeable functional weakness from one side to the other, usually significantly loss of motion, possible loss of bowel control and bladder control. Okay, now for the last one. The last type of disc herniation is a disc sequestration. Now, sequestration is the most severe form of a disc herniation. This is where a portion of the material actually breaks off. It extrudes off, right? So the annulus fibers breaks through the nucleus fibers. The nucleus pulposus gets broken through, right? The gel-like material bulges out. It comes out through the annulus. And not only does it come out, right? So a lot of times it comes out and it'll hang down. It'll go down. And that's when you have the extrusion. But when you have a sequestration, part of that material actually breaks off, right? So it actually breaks off and it extrudes from the nucleus pulposus. So part of the nucleus comes out, goes right through the annulus and breaks free. And then you have a free fragment in the spinal canal. If it's above L3, L4, then it's in the spinal canal. Actually, you can bring it all the way down. Well, that's another topic that we'll discuss another day. But you could typically have it break free into the canal. And if it breaks free into the canal, it can migrate away from the body of the disc, which can cause severe pain, severe neurological deficits, and is typically a medical emergency and needs immediate attention. So this fragmented, free-floating disc can move into the spinal canal, causing ranges of symptoms that are severe due to the free fragment in the canal, affecting the nerves of the cord. So common symptoms: severe localized pain, pain that's affecting motion, muscles, usually involves either one of your leg or both of your legs, and either one of your arms or both of your arms. The numbness and tingling can be severe. This is no joke. This is severe pain, and you're going to have typically severe muscle weakness. The weakness is very noticeable, and over time, you can have one side be visually different than the other side. Bladder and bowel control issues. You can definitely have changes in your bladder or bowel control. That happens, that is a medical emergency. You need to get to the hospital ASAP. You have bladder or bowel control problems, you need to get to the hospital ASAP. So the typical presentation is severe pain that affects the lower back, the legs, the neck, or the arms, with severe neurological defects, right? Your reflexes are changed. You lose sensory function, right? Your ability to feel anything touch you, you can't feel it. You have significant numbness and tingling. Severe noticeable muscle weakness. And again, the possible bowel and bladder control. Severe decrease in motion. This is no joke. This is a medical emergency that needs to be taken very seriously and needs to be seen at the hospital ASAP. So let's review symptoms of a common disc problem, right? So typically when you have a disc problem, you're going to have pain in the back or neck. If it's in your back, then you can have sciatic tight pain that goes down the legs, or pain in the arms that goes down into the hands. With that, you could have numbness or tingling, muscle weakness. The specific area is going to affect whether it's your cervical spine, your thoracic spine, or your lumbar spine. So what are the main causes of disc herniations? The main causes are degeneration, right? We said this, due to aging, disc wear and tear, spinal injuries, sprains or strains. You go to lift a 1994 TV and it is 350 pounds, you're going to have a problem. Poor posture, poor ergonomics and lifting. Sometimes there are some genetic links to family history. Lifestyle factors, right? Smoking, obesity, sedentary behavior, no exercises. How do you typically diagnose a herniated disc? So typically you diagnose it by physical examination, right? You're going to examine the patient. You're going to go over a detailed history. You're going to you're going to get the strength checked, your muscles checked, your sensory checked. You're going to do orthopedic testing. You're going to do all your typical tests to identify. So we're going to have all of those. Then we're going to typically do x-rays and potentially MRI or CT scan. So that's typically your MRI is going to be your go-to test for confirming a disc herniation, right? So when I do my exams, I'll do a workup to say, okay, patient has lower back pain, patient has pain down the leg, pain into the big toe of the right. Okay, I think that patient has a disc herniation. In fact, I think that if he's got it in the big toe, I think he's got an L5S1 disc herniation. Every nerve in the back is controlled by different areas, right? So an L5S1 disc herniation, you're going to have pain down the lower back, into the leg, into that big toe. That's typical. I'll do an MRI to confirm what I think I have based on my physical exam. But my physical exam is crucial for me to determine if I'm going to order an MRI, if I'm going to wait, if I'm going to do conservative care initially, how I'm going to proceed, right? So if a patient has some of those severe symptoms, like we talked about, those severe symptoms in an extrusion or a sequestration, I'm going to be sending usually those patients out. Those protrusions we'll typically take care of. So what are some non-invasive treatments for disc herniations? Chiropractic care, adjustments, right? So that's what we do. We take the pressure off the spine, realign the spine. We have a lot of different therapies to help with herniations. Certain levels of herniations, right? When you start, if I have a sequestration, that's a no-touch patient, send that patient out. You're not touching that patient. That patient you can't help. That's usually a surgical case. So for all the other conditions that we talked about, definitely can do chiropractic care to help treat, align the spine, take the pressure off the nerves and increase function. That's typically our bread and butter. That's what we do all day, every day, right? We want to open up those areas, open up your garden hose, let the flow of your nerves come through. That's exactly what we want to do. And that's the reason why we adjust the spine, right? We adjust the spine to take the pressure off your nerves, open your garden hose, get the floodgates open so you have an increase in function. We also want to do some physical therapy with some target exercises to help strengthen the areas that are supporting the spine, as well as increase mobility. You could do acupuncture to reduce pain and inflammation. Lifestyle changes, weight loss, weight management, right? Obviously, the less we weigh, the better we usually feel. Better ergonomics, proper body mechanics if we're lifting. We could do massage therapy. Massage therapy can help reduce muscles tension and improve circulation. Increase in rest and activity, right? So avoiding things that increase the pain, if you know that it's doing that, getting enough sleep will be critical. What are some pain management avenues to help you? Over-the-counter medications, NSAIDs like ibuprofen, Aleve, lifestyle modifications, again, they typically want weight management to reduce stress on the spine. They can also talk about different injections, whether you talk about steroid injections or some light injections to help decrease pain. You could do PRP, platelet-rich plasma. PRP is when you draw your own blood, spin it, and then you take the plasma, and they can treat certain conditions with that to help improve the body's ability to heal itself, right? Sometimes there are surgical cases, right? When everything else fails, then you want to look to surgery. There are different types of surgeries. Microdiscectomy is when you remove part of the herniated disc. So part of that material that has herniated out has broken through. You could do that type of surgery. Laminectomy is when you remove part of the vertebrae, right? You remove part of it and either you fuse it or there's a lot of other techniques that they use now for laminectomy to relieve the pressure. So, but it's basically take some pressure off where the nerve is, right? So you're going to open up the lamina, you're going to remove part of it and take the pressure off. They do have disc replacements now. So they have artificial discs that they can implant in the spine. They have endoscopic discectomy using tiny instruments to take out the disc. Medical also has some laser therapies to help heal it. A little different type of approach. But in talking about this, the integrative approach and responsible pain management is typically what we do in our office, right? So you say, Doc, what do you do in your office? So we have an integrative approach of responsible pain management. And we want to really do a good job with making sure that we do some early detection, right? So in general, let's just go in general. Let's recap it in general. So early diagnosis is key and early intervention is key. Utilizing non-invasive treatments first and then follow it up, as the treatment progresses to more medical options. Looking at holistic approaches to care is important. That is typically how we do it in our office, right? So we want to be holistic first, and then as we go, if we're not getting the results we want, then we have all these other options to utilize. So that's typically what the Health and Spine Wellness Center is. We are a integrated medical facility to help treat patients from holistic naturally as we can first, and then we progress as needed. The whole goal is to get you functioning and moving again, right? The goal is to get you to move and do better, to be better. So identifying what you have and treating you properly is crucial for how we're going to help you and how we're going to heal treatment. If you have any of these conditions, I suggest you see a professional. It is important to don't wait. A lot of times patients wait. Oh, I want to see what happens. And then things get worse and worse and worse and worse. And over time, your options change. The more you wait, things get worse. The earlier you take care of it, the better you will do, the better you'll feel. So as I end all my sessions, this information that I just gave you is my opinion alone. If you are experiencing any of these symptoms, what I've given you is not medical advice, not medical treatment, not a solution for you. You need to go see a professional. Let somebody analyze you and determine what you actually do have. Don't be a Google doctor. See an actual doctor. But pay attention to those symptoms that I told you. Go see a professional. So nothing I said should be construed as medical advice or medical treatment in any way. This is just my opinion alone. So with that, I'm going to wrap up this discussion on herniated discs. And what I will tell you is this: It's your life. Be there healthy because health matters. Be well, be safe.